The CDC is reportedly set to release new air travel guidance for people who have gotten their COVID-19 vaccine. McClatchy reports that CDC officials could unveil it at today's White House COVID-19 response team briefing. Airlines struggling during the pandemic have pushed the White House to update the guidance for people who want to travel this summer. For more on this, let us bring in Dr. Bob Lahita. He is the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health and also a professor of medicine at New York Medical College. So, doctor, in your opinion, let's talk about air travel right now. Is air travel safe? What precautions should people take? I note that throughout the entirety of the pandemic, Dr. Bob, what you and other medical experts and professionals have always told us is that it's not so much sitting in the plane that is the risk. It's the interactions leading up to that moment when you're actually comfortably seated in your seat, right? Like getting into a taxi, for example, and at the airport and all that stuff that happens before.
Yes, that's right, Vlad. So it's a big concern. It still is a concern. And I think Rochelle Walensky and others at the CDC would say, if you don't have to travel, if you don't have to fly, don't do it right now. There's been an uptick, of the infections, and we're seeing it unsettling highs in the New York, New Jersey, Connecticut area, for example. So they're going to come out with regulations today. Currently, to fly from a foreign country, you have to prove that you have a negative test before you get on the airplane, before you even get in line. And once you're here, you have to quarantine for 7 days. That may all change. The travel industry is having a conniption over the fact that their business has dropped so significantly during the pandemic. So that's going to change. And I look forward to seeing what the new guidelines are today. Vlad.
So I think, one of the more challenging things about this virus is that often, doctor, frankly, we hear conflicting information. One study says one thing, another study says something else. So now we have, Dr. Walensky, director of the CDC, who said earlier this week that there's new data that suggests that vaccinated people don't spread the virus. But then the CDC released a statement to the New York Times saying that it's actually not clear whether vaccinated people can spread the virus or not. At the end of the day, we just want to know, what can we do, right? Where can we go? Where can we not go? When do we need a mask? Are there times that we don't? Easter Sunday's coming up. People are going to gather for big Easter meals. There are going to be older family members, perhaps, that have already been fully vaccinated, with younger family members that have not. What is your advice? What should people be doing?
Wear your masks. If you're in contact with younger family members who have not been vaccinated, wear a mask. Now, I got that report with regard to transmission of the virus, and it was said that if you were vaccinated, you don't transmit. And then today, of course, as you just mentioned, the report is out saying, yes, you can transmit. So really, the studies, the data are not in. I think it is extremely unlikely that you transmit the virus after you've been vaccinated, but you can still harbor it. Now, it's interesting that applies to little children and teenagers as well. We were comforted by the fact that the vaccines protect kids 100%. So we're saying to teachers, gee, you don't have to worry anymore, because if you go into class and your kids have been vaccinated, you're free and clear. But now they're backing up a little bit on this, and we need more data to assure all of us that if you're vaccinated, you will not transmit. But if you're in a holiday situation with Easter now and at the end of Passover, make sure you wear your mask and be very careful with people around you.
Dr. Johnson & Johnson announced today that they're adding 12 to 17-year-olds to their vaccine trial. Drug makers have been adding younger and younger people to their trials lately. How long could it take to determine how safe and effective these shots are in younger folks? And what will that mean for the next school year?
Well, it means great things for the next school year, because the data that I've seen suggests that young people that are immunized with the vaccine will not develop symptomatic COVID-19. Now, they may be infected. We're not so sure about that yet, but they are not likely to transmit it. I think the transmission rate is going to be low, 0.001%. So that's good news for teachers. It's good news for schools. We've always said that when kids get the COVID infection, they do not really show symptoms. Barely few of them show symptoms, very rarely. And so that's okay for schools. We were worried more about the teachers, and all teachers should be vaccinated, Vlad, completely vaccinated before going into the classroom.
Doctor, there have been a few sort of a handful of cases of people who have been infected after already receiving the vaccine. You know, we're talking about millions of people who have received the vaccine, so it's not like a large number, but our Orlando affiliate reports that there are a few dozen in Florida. Our Seattle affiliate says Washington State has seen a little more than 100, what they're calling breakthrough cases. So how does something like this happen, and how unusual is it?
It's very unusual, Anne-Marie, and I was startled to read that 2 weeks out of their second injection in Florida, several people were infected. Only maybe 1 out of 20 wound up in the hospital emergency room. None of them wound up in the hospital as inpatients and in the ICU with ventilators. But the fact that you can be reinfected or infected for the first time after the vaccine means that the vaccine is not perfect. No vaccine is perfect. This vaccine is probably the most perfect vaccine I've ever heard of at 97% efficacy. The flu vaccine is only 40%, gives you a relative, some relation to the actual infectivity rate. But it is disconcerting. And in Seattle, there's also been a number of cases in Washington State, about 0.01% of vaccinated people have been reinfected. So it's all the more reason to wear a mask and not drop your guard and say, oh, this pandemic is over. It's not over until it's over, and that will probably be at the end of July, the beginning of August at best.
And it's, I guess, something interesting to point out or to note, Doctor, which is that the efficacy numbers come from the pharmaceutical companies themselves. So we're still sort of at the beginning, of understanding the efficacy of these vaccines. I know that it's very high on all three that have been approved, but who knows what it'll look like a year from now.
That's right. It's right, Vlad. If I had a time machine, I could go forward. We will know a lot more in a year or so about how this virus really gets into us, what it sticks to, who it sticks to, and why it sticks to us. And that's interesting because, every human being on the planet is different genetically, immunogenetically, and has different immune systems. So we're beginning to understand, we're beginning to see all these variations on a theme after vaccination and certainly without vaccination. So I think once herd immunity comes around, probably at the end of this year, and we all go back to normal, we're still going to have this virus around. It's probably going to be with us forever. And we're going to study it and see how it really gets in and how it really works.
Well, speaking of variations, the National Institutes of Health has started a new clinical trial to test a vaccine designed by Moderna that is meant specifically to protect against the variant that was detected in South Africa. How does this new version of the vaccine work? What makes it different?
Well, they're giving it to younger people, actually, to see how the vaccine works with regard to, as you mentioned, the South African variant. But it can apply to probably all the variants. We believe that these three vaccines that are currently approved will protect us from the British variant, the Brazilian variant, and now talking about the South African variant. So they're going to enroll about 200, I think the number was 260 people in this study. Some who are vaccinated, half are not vaccinated, and see genomically whether the variant appears in those who are vaccinated. And this will be a wonderful thing, and it will also tell us whether we will need re-immunization next year and the year after, and so on.
All right, Dr. Bob, Lahita, thank you so much for joining us this Friday.
Happy Friday to all of you.